Good afternoon. My name is Janet Thurston, and I'll be presenting to you my capstone project, which is titled Nurse Practitioner, Certified Nurse Midwife, Electronic Health Record, Utilization Satisfaction. The problem related to this topic is that EHR utilization improves the quality of healthcare, and EHR utilization satisfaction plays a decisive role in its use, yet there is little known regarding NP and CNM EHR utilization satisfaction. The needs assessment completed for this topic involves looking at EHR users who believe that they improve the quality of care. They are generally satisfied with utilizing EHRs. Investigating NP and CNM EHR utilization satisfaction is needed. Furthermore, collaboration is needed on this data. As an introduction to this topic, it is to consider that EHR utilization can improve clinical outcomes. An EHR can achieve quality improvement in practice, but utilization satisfaction is needed to do that. There is little known regarding NP or CNM EHR utilization satisfaction. EHR utilization satisfaction examines EHR quality that leads to improved patient care for all providers. The purpose of this investigation was to investigate NP and CNM EHR utilization satisfaction. The process was to collect data, analyze it, and then report results today. When examining the synthesis of the evidence, there was an evaluation of EHR utilization satisfaction. What actually supports satisfaction, and what actually are barriers to satisfaction. In considering the synthesis of the evidence, supports for it include that EHR utilization can address health disparities, it can improve health outcomes, there are results in cost savings, and it promotes improved population health. These are supports of utilization satisfaction and EHR use. Background issues related to EHR utilization satisfaction begin with financial issues such as costs. When EHR utilization satisfaction declines, it may increase costs, reduce clinical productivity, and profit. Political issues include legislation, including the HITECH Act of 2004, which included the meaningful use legislation which affects Medicare and Medicaid incentives. Other backgrounds included ethical issues such as beneficence and non-maleficence. This includes the benefits were meant to benefit clients as well as providers, which means it should benefit the time and effect on patients as well as providers. We all should benefit from better outcomes in care and practice. Non-maleficence means there should be no injustice put upon patients or on providers in time, practice, or outcomes. Cultural aspects of this include there should be leadership in our practice. We ourselves should be leaders to create better outcomes. The organizational cultural changes mean that we should be leaders in this process, developing the product ourselves, making choices in practice, and leaders in it, improving the cultural safety practice changes. The conceptual framework adopted for this capstone project was the Don-Obedient Theory framework, which includes looking at antecedent conditions, the structural care process, and the outcomes, which overlooks patient safety management. This is also often applied for quality improvement programs within healthcare systems. The way that this conceptual framework was applied within this capstone project was examining satisfaction prior to adoption of EHRs. What was our satisfaction prior to EHR use in documentation and in workflow processes? When our structural environment was changed and our care process changed with EHR use, there were workflow changes. How did this impact the outcomes of our satisfaction as providers? The goal and objectives of this project included examining the improvement in quality of care through NP and CNM EHR utilization satisfaction overall in time, and the objectives of this were to collect the data, to evaluate and analyze it, then report the data. All of this is based on evidence-based practice outcomes. The methodology of this approach was to have a survey designed with a convenient sampling of EHR utilization satisfaction of NPs and CNMs in the Frontier Nursing University academic setting. The inclusion criteria were CNMs or NPs that utilized an EHR for at least 6 months in practice, and there was a validated survey tool instrument used with the SurveyMonkey investigation. An IRB or Institution Review Board had to approve this process. First, then, there was an invitation to the survey subjects via an email that included informed consent, then proceeded to the survey, which then allowed me to collect the data and analyze it. Then, after this, was reporting the results as I'm doing today. In the implementation of this project, as the data was collected, there were various domains used to analyze the data. These included looking at baseline demographic characteristics of the sample groups, looking at attitudes towards computers, looking at general satisfaction with an EHR use. There were perceived practicality of use, variations from familiar practice, organizational support obtained, and impact on delivery of care. When looking at the outcome analysis, we first looked at the demographic data through descriptive statistics and percentages. We then looked at the Likert scale survey, examining mean results with standard deviations, frequency data. T-test groups were looking at means comparisons of groups, the CNMs versus the family nurse practitioner data. The demographic information is included in that the CNM groups were 33%, 14 were the numbers. FNPs were 58%, 25 were the numbers. CNM and FNPs were 9%, representing by 4 of the sample groups. 43 participants were in the study as subjects. Now I will report the domain groups in mean totals. The general component of the domain was to look at the overall satisfaction. The overall score was generally 3%, which is generally satisfied numbers. Anywhere above 2% was generally satisfied. So at 2.9% is a generally satisfied EHR utilization. We look at details. It shows that colleagues had favorable opinion. The wish that I could just write in paper was a 2, which is a fairly negative component, meaning they're overall satisfied with the EHR use. Benefits outweigh inconveniences would be to say yes. System easier to use. Does that become more familiar? Yes, and it's yes. In other words, overall satisfied. When we look at the next domain of user expectations, again, the overall score was generally satisfied. We look at details. Again, they were all generally satisfied throughout the domains. Experience with the system, use of EHR, improved care delivery, improved billing. When we look at screen designs to optimize patient care generally, when we think that they were used as a teaching tool, that maybe have less, the overall score was generally positive. In the domain of impact on delivered care, this was where it was the highly scoring the highest. The overall score was 3.3, but it was mostly to say the impact of delivering care was most positive overall and in comprehensive ways. When considering the domain of practicality of use, it was generally, again, overall positive. When we look at structures of the documentation that templates teach, that they have anticipatory guidance, that they are efficient, and that they're suited to the specialty was generally positive. Again, as we look at practicality of use for urgent visits, was generally well provided in that use of text, that it was straightforward, that the questions could be answered, that they could finish their notes before leaving clinic, and that was one of the most positive across the board amongst providers. The overall score was generally positive. When considering organizational support, again, the overall score was generally high, but it said that I was adequately trained in use was one of the lowest scores in this department. APNs generally viewed the system favorably. Technical support in the system was available in general. When considering the variation from familiar practice, there were components of interfering with provider-patient relationship, and it was to limit the ability to include important content. It may have been a consideration to look at. Making your encounter documentation more efficient was a positive impact. Fits in with the way I'm accustomed to writing my notes, the positive impact. Overall score was generally positive. When we examined some of the most important impacts, which was EHR satisfaction, the impacts on patient care, how EHR interferes with relationships, the issue of training, and the free texting, there were no differences between CNMs or FNPs, and in general, overall, there were no differences between CNMs and FNPs. As you can see in the P differences, everything was above the 0.05 level. In issues of adequate training, it was actually equal between the feelings between the two groups. When we look at the outcome analysis of this investigation, we can see that the attitudes towards computers were generally positive, that there was general satisfaction amongst both groups with the use of an EHR. There was a perceived practicality of use. There were some similar variations of familiar practice. Organizational support was similar, and impact on delivered care was thought to be positive. These slides represent what we call the frequencies in a pie chart form of presentation to demonstrate the overall responses to these questions. On whole, how sophisticated a computer user do you consider yourself? The general group did see themselves as sophisticated. As you can see, the green component was sophisticated and very sophisticated to overall sophisticated. Very few were not. The most significant of this investigation was the EHR utilization satisfaction. Looked at FNP and CNM positive EHR utilization satisfaction. The FNP and CNM responses agreed that the highest scores were positive impact on patient care. This is the overall frequency to demonstrate how many agreed that it was EHR use was generally satisfied with EHRs. Overall, strongly agreed and agreed that it was satisfying. Very few agreed, disagreed that they were satisfied. Of all slides, this is most significant to say, I believe that the use of an EHR can improve care delivery. Very few disagreed, and overall, this slide represents how many agreed to strongly agree. The lower scores of satisfaction potential factors were changes